Do you actually ensure that health sector development becomes real in the lives of Nigerians?
Well, this is one case example where the President unveiled an agenda, the Health Sector Renewal Investment Initiative, with 4 pillars. And we've been working relentlessly in the health sector to implement that vision, to translate it into reality. The governance pillar, which brings the federal government, states and local governments, private sector, development partners, to orient ourselves to respond to Nigeria's citizens' needs in terms of health, to be more transparent, more accountable, and to have really appropriate regulation for the sector, to do what it takes to improve health outcomes, to promote health, to prevent it, to expand primary health care, and to expand our hospital capacity, our infrastructure, as well as human resources and health insurance. Thirdly, to unlock the healthcare value chain, to begin to produce the things that we need to consume in our health sector while creating and retaining some of the economic value, as well as delivering safe, effective tools, as well as health security, with an underlying theme that we need to digitally transform the health sector, and the Nigerian Digital Health Initiative is one example of that, and to defragment it. Now, a year later, after the President's unveilance of this, with the resources that he has provided, with his guidance, we're at a point where we can take a stock for the first time in the joint annual health sector-wide review, which will take place this week. But it's not just about talking about what has happened. There are facts, there are numbers to back up the performance, so that we learn, as a federation, how far have we come? How have we done in certain areas, and where have we fallen short? Not to pass judgment, but to learn the lessons and double up our efforts so that we respond to the needs of Nigerians. So this week, there are 2 important pieces of reports. One is the Demographic and Household Health Survey, which has interviewed 46,000 households in Nigeria to look at the state of their health compared to 2018 and late 2023, October, November, December. Where are we? And there is good news in that regard. There is also still work to be done. And the second part is to look at the perception of Nigerians regarding the health sector. Last year, we did a People's Voices survey, where 2,500 Nigerians were surveyed in a robust manner. We have a sense of their expectations and their experience. This year, we have a perception survey of 2,600 Nigerians. So we know, for instance, that Nigerians' confidence on the sector and their confidence that government is able to respond to health emergencies has improved. We know that there is confidence in the services that has been provided, almost half Nigerians surveyed. In other areas, there is work to be done. We know that utilization has increased, whether it's diabetes testing, blood pressure measurement, cholesterol measurement, and prostate screening among men. But we know that there are gaps. We've seen decline in women going for mammography. So we're calibrating these numbers to sort of understand what are Nigerians wanting us to do more. And there are several other elements. We also now have a feel for the population health of Nigerians. We know now that there has been some progress in reducing child mortality, that diarrheal diseases has reduced, that lower respiratory infections have reduced by 30%, and that we've got modest reduction in HIV as well as slight reduction in malaria. We've seen increase in immunization coverage. Full immunization coverage indeed has increased from 31 to 39%, although the zero-dose children who had been missed from immunization has also increased at the same period of time. So with the increase in access that we have seen from Nigerians over the last several years, we are also seeing in the last 12 months that the cost of care has increased, which means a lot of Nigerians are also struggling to afford this increase in access. So the idea is that with facts, not stories, not opinions, that we begin to tell the story of Nigeria's health renewal and to hold ourselves accountable. And each state of the federation has a scorecard which we can tell the direction of its travel, whether it's increasing. Take contraceptives. 6 states in Nigeria have doubled their modern contraceptive prevalence rate, and 21 states have had increase overall, but there are some that are lagging behind. So with that information, state governors, their commissioners, their primary healthcare agencies know how to tackle those more. For those who are succeeding, we can begin to learn what are they doing right. The idea is that we are accountable to the Nigerian person, to the Nigerian citizens. And that is the idea of improving governance that the President feels is really key, part of driving this agenda of improving the health and well-being of our population to achieve a prosperous, peaceful country ahead. And we believe that we are on our way to do that. This is just the first year, and there's a lot more that is coming ahead.
All right, Prof. This People's Survey, what exactly was your major takeaway from that survey when it comes to access to health?
So, important really takeaways. First of all, Nigerians have confidence, and that confidence has increased from the People's Voices survey in 2023 to the one that has happened now in 2024, that government is competent enough to deal with health emergencies. The numbers have increased. We have also seen increase in access, 10 to 15% in some cases, in terms of Nigerians responding to the urgency to track and measure their numbers. Hypertension measurement among those that have been surveyed has increased. People go and check their blood pressures because we know non-communicable diseases are rising as a burden of disease. Diabetes. We've seen increase in tests for cholesterol, for instance. But we've seen a decline in women that are going for mammography. And we now have to look at, okay, is it the services that are not there? And finally, an important takeaway is the cost. The increase in access has come at a cost, and the costs have escalated. So cost of drugs, cost of access, which adds to the pressure that we have to expand health insurance. We have seen increase in health insurance from 16.7% to 19.1% in the third quarter of 2024. That's 2.4 million Nigerians. And almost all of that increase is from public health insurance, from NHIA and the state health insurance authorities. But the private health insurance has flatlined, which means we need to do more to expand private health insurance for those who are in the informal sector, to revamp this effort, to accelerate the progress. We've done well, but there's a lot more that we need to do to reduce the out-of-pocket spending by Nigerians to access health care. That's an important insight. We're also doubling up in the medical relief program, which the President had approved, to make it easier to absorb the shock of rising drug prices for many Nigerians, particularly the poorest and most vulnerable. Mind you, there are preventative measures that we had also put in place that will accelerate, whether it's vaccination to prevent diseases among children, which is much more cost-effective, or it's in the campaign that is currently underway, Know Your Numbers campaign, that is happening all over the country, where 10 million Nigerians will be supported through the state government, through the state commissioners of health, with support from the Federal Ministry of Health, to know their numbers and control their numbers. Know your blood pressure, check it. Know your blood glucose, check it, and be able to control it. By doing so, we can keep more Nigerians healthier for longer, to avoid the extensive cost of medical care. So these are some of the insights we're drawing from the People's Perception Survey, and it's weaving into the work that we do and that we will continue to do ahead, because we realize that health is a critical ingredient for prosperity in our country, even for peace in our country. And the well-being of the Nigerian person is core to this vision that the President has articulated very well.
All right. So I see that you're hosting the health sector's first joint annual review, along with all 36 states' health commissioners, along with donors and development partners. You know, it's interesting to know that there is this collaboration between the Federal Ministry of Health and the states. You know, over the past decades, Nigeria has seen major attempts to strengthen primary health care and move towards universal health care. There are different reforms. We've had the Saving 1 Million Lives initiatives, the National Health Act. And stakeholders would say both initiatives were successfully adopted, but faced political and institutional challenges to implementation and sustainability, thereby leading to the importance of addressing accountability gaps in the health sector. This commitment you've shown to working with state governments in an effort to double primary health facilities nationwide. You're saying you're moving it from 8,000 to 17,000 within the next 3 years. Are we actually on course for that?
We're confident that in the direction that we have taken between the federal government, states, and now local governments, that it is possible for us to hit those targets. You recall that we signed a compact with all the 36 state governors and the federal government, and was witnessed by His Excellency Mr. President under his leadership, and 17 development partners. This was in December 2023. And that compact governs the relationship, including the accountability measures and the provision for quarterly performance dialogue and the joint annual review. So we are precisely implementing that compact by having the joint annual review for the first time. So for many years, we've talked about the fiscal federalism and how it relates to health. But here we are acting in a manner that is consistent with that frame of governance, whereby federal government, states, local government come together, review progress, review learnings, and continue. To sustain it, I believe the instruments are there. There's a legal instrument of the Health Act. This is consistent with the vision of the Nigeria Health Act, which sees a national health system. It's also consistent with the policy approval that we obtained at the National Council on Health in November 2023. It's consistent with the approval of His Excellency Mr. President of the sector-wide approach. It's also matched by behaviors that allows us to think that this is owned. It is not just one arm of government loading up to others. All the 36 states of the Federation have signed up, and they have desk officers that are collaborating with us in this joint effort, because we see that we have to join hands. In addition, we've raised financing. We've got concessional financing, grant financing to complement the 1% of the CRF that is put on the table by the federal government, which goes to the primary healthcare centers. More than 8,000 of them already are receiving those funds on the Basic Healthcare Provision Fund, MPHCD Gateway, which supports them to mobilize the health workers, buy needed commodities, get fuel, maintain the facilities, and we've increased it. And on the insurance side, to expand the Vulnerable Groups Fund, as well as on the NCDC for health security to respond to outbreaks, and for the Emergency Medical Treatment Scheme. Small as the monies are, it's a contribution that the federal government is putting, in addition to what the development partners, International Development Association, has put to back this president's agenda. So with that, we see the elements are in place. Because if you have a plan that does not have the resources behind it, it's fiction. Improving the health of Nigerians is not going to be at no cost. It has cost. The only thing is that
Prof, how do you ensure accountability? And are states and local governments truly cooperative?
Yes, we are seeing that. We're seeing that complementing the federal government's effort. We have increased federal government's contribution, and we're asking them to also increase state contribution to the health sector. And we're going to be tracking that over time. And we're seeing the collaboration between the arms of government really showing that we all own this effort, that jointly we'll have to do this. Now, on the fiduciary system, to ensure the resources that we're putting through this system is used for the intended purposes, we've made decisions on the disbursement of these resources in public, with media present. We've asked the fiduciary agencies in government to keep track, to be sure that no one diverts the resources in the front end, that when the resources are channeled through states to the primary healthcare centers, the workers out there will use those resources for the intended purposes. We put in a hotline, an email for reports, so that there's more transparency. And the fact that we're coming out to look at performance as well, regardless of how you spend the resources, it should be matched with commensurate increase over time in terms of utilization by women, in terms of immunization. That's the direction of holding us accountable. You cannot hold anyone accountable without good data. The absence of data, in a way, allows folks to be able to get by with stories. But we are now moving in a direction that there is going to be data periodically that will assess how far we're going. It may be risky, because if things don't go as planned, one could easily be attacked by the public. But we're willing to take that risk, so long as we take it that we will learn. If something is working, let's do more. If it's not working, we want to know earlier so that we can course correct. And I believe that's the spirit that even the states are joining us It's not to cast blame, but it's to really see how we can improve and course correct where necessary in an adaptive manner so that we improve the population health outcomes for Nigerians. We improve the financial risk protection, and that we're doing so equitably, that we don't forget the poorest and most vulnerable, our women, our children, and the poorest in our society as we improve the health of all Nigerians.